Hello everyone, it's me Lakshmi Sharu. Today we'll be talking about assignment 2 from Nursing KC, and we have Sophie and Jay who will be joining us later on to discuss about their part of assignment. Let's go. Okay, let's go to contents. So we have 3 sections. Section 1 is about the Australian National Health Priorities. Section 2 is about the burden of chronic disease in the Australian context. And the last, Section 3, is about the nursing implication now and into the future regarding the burden of disease and the role of nurse in chronic illness management. Today, I'll be discussing about the Section 1, which is the Australian National Health Priorities. Okay, let's talk about National Health Priority Areas. It is a collaborative approach between Commonwealth, state and territory governments to deal with a range of health conditions that are associated with a high financial burden and a high burden of disease in Australia. It basically means that every year government has to spend a lot of money for those medical conditions, and there's lots of cases in Australia, for example, dementia, heart disease and mental health condition. So it was first known as National Health Goals and Targets, and it was first originated in the late 1995. So what it does, it works to improve the health and the well-being of Australian population and make health services accessible to all the population, and basically works to reduce the burden of illness. I have included a bit of the history and the background of the National Health Priority Areas. You can read over here. So we have 9 National Health Priority Areas. Today we'll be discussing about only 8 of them. The first one is cardiovascular health. According to the Australian Bureau of Statistics in 2018, it accounted for 13% of the total disease burden in Australia, while cancer accounted for nearly 18% of the total disease burden in Australia. The fourth one is mental health. According to the Australian Institute of Health and Welfare in 2015, mental health condition accounted for nearly 12% of the total disease burden in Australia. And according to the survey which happened between 2017 to 2018, 1 in 5 Australians had at least one mental health condition. Another one is diabetes mellitus. So the survey which happened between self-reported data which happened between 2017 to 2018, about 4.9% of total population had diabetes, and 11% of Australian deaths were associated with the diabetes in the same year span. In 2015, it accounted for the nearly 2.2% of the total disease burden in Australia, while asthma accounted for 2.5% in the same year span. Arthritis and musculoskeletal condition. In 2015, it accounted for 13% of total disease burden in Australia, while obesity accounted for 8.4% and dementia accounted for 3.8% of total disease burden in Australia in the same year, which is 2015. The last part of the section 1 is to discuss about the National Strategic Framework for Chronic Illness. It was first developed in 2017 by the Australian government. So I have included a bit of history and background for this framework, and we'll be discussing about its objective in the next slide. The 3 objectives of the National Strategic Framework are listed below. It was established for the management of the chronic disease in Australia. Due to the complexity associated with the chronic condition, it is very difficult to measure the progress of the success of the framework. That's why the policymakers will be up to date with the data and information so they can track the progress of the framework. Now I'll be passing to Sophie, which she will be discussing our section 2. Thank you.
Hi, my name is Sophie Siriam, and I will be doing the second part of the presentation after Lakshmi. So I've chosen cardiovascular disease, which is the burden of chronic disease in Australia. Table of contents. I will firstly discuss pathophysiology and etiology of cardiovascular disease. Then I'll discuss the impact on people who have cardiovascular disease. And then third, burden of disease of cardiovascular health. Pathophysiology and etiology. Cardiovascular disease are heart and blood vessel disorders that affect the blood circulatory system. Usually it occurs when blood vessels and arteries get blocked and become too narrow with plaque. This process is also known as atherosclerosis. Examples of cardiovascular disease include coronary heart disease, rheumatic heart disease, congenital heart disease, deep vein thrombosis, pulmonary embolism. You can see pictures here that I put up for you. Heart disease can be managed, however, there is no cure. Risk factors. Non-modifiable risk factors includes age, ethnicity, and family history of heart disease, whereas modifiable risk factors including high blood pressure, excessive alcohol use, physical activities, obesity, depression. So when these risk factors are addressed, make sure that services are affordable and accessible. So working with government and health professionals in the general community can actually help. The impact on people with cardiovascular disease, men usually experience just chest pains, whereas women usually experience chest pain, shortness of breath, nausea, and extreme fatigue. Mental health. Mental health disorders can cause anxiety and depression, which can lead to alcohol and tobacco use and an inactive lifestyle, which also can lead to heart disease. Coping mechanisms can become difficult. The impact on people, financial burden. Suffering from coronary heart disease can cause financial hardship on individuals. For example, people suffering from acute coronary syndrome who suffer from a STEMI, which is a heart attack, usually cannot return back to work and will lose their income. Out-of-pocket expenditures for an average person is approximately $258 per person. Premature death. Premature death is usually caused by high cholesterol, high blood pressure, and smoking, which is typically from cardiovascular disease. It was found that in 2017-18, there were 1.6 times greater people with cardiovascular disease in lower socioeconomic areas in comparison to higher socioeconomic areas. Burden of disease measures population health and sets out to assess discrepancies between living an ideal life to old age in good health and living a real life in which a healthy life is stopped by illness, injury, disability, and dying prematurely. It was found that in 2017-18 that 641,000 men suffered from coronary heart disease and 509,000 females suffered. Although more men are likely to suffer from heart disease, usually women heart disease goes unnoticed as they're usually too busy. So increasing their knowledge and education will actually help more under diagnosis. Aboriginal and Torres Strait Islanders and remote living. In 2018, 27,400 Australian Aboriginals were found to have coronary heart disease. So twice as many Aboriginal Australians had heart disease in comparison to non-Australian Aboriginals. So greater public promotion, education, research, investments need to be provided in order to close the gap. Hospitalizations in rural and remote places were roughly 47% higher in rural areas, which also had lack of health services. People had to travel significant distances and cardiac screening was very low. Here you'll see the graph which actually states out the differences.
Hello Sue, my name is Jay, and together with Soph and also Lakshmi, I'll be presenting my section number 3. And in the content page, I'll be talking about the nursing implication in relation to the increase of burden on chronic illness, and also be talking about roles of nurses and multidisciplinary team in managing chronic illnesses. And the last part is talking about the clinical nursing implication relates to a patient that has multi-comorbidities. So the slide that I'm going to talk about today is on the nursing implication in relation to the increase of burden in chronic illnesses. So as you know, that chronic illness is a long-term disease and that cannot be fully treated, but is manageable under certain circumstances. Pharmacological, non-pharmacological method, or even therapy such as chemotherapy to control the cancer cell from growing is also another option. Patients actually needs to be aware that they have to regularly attend checkups, and also make sure that to make sure that the level does not deteriorate, or the cancer, for example, the cancer cell doesn't relapse. And because there's a lot of nurses that is in demand right now, so the workforce that we have is not able to cater for everyone. So what is suggested is that the patients or the family liaise with the district nurses to help them, so that they could get the help of people that, or the nurses that is in their community, to help them grow or be better. In the next slide, I'm going to talk about the roles of the nurses and multidisciplinary team in order to manage those chronic illnesses. So we know that in order to manage a chronic illness, we need both hands in, or probably more people who are professional in order to handle this management of the illness, using a evidence-based approach, obviously. And also we need to have a patient-centered care. We need to have very good language, using a plain ones and not a medical term. And also, if the patient doesn't understand English, so we use a translator. That would be translation services provided in the hospitals. And also, our nurses are a very important person as to advocate for the patients. The last slide I'm going to address is on the clinical nursing implication relates to caring for patients with multiple illnesses or multiple comorbidities. So when there is multiple illnesses in a patient, specialists or professionals from each type of illnesses needs to come together to help with managing these illnesses. Patient education needs to be done, family has to be educated that certain kind of illnesses has to be addressed beforehand. For example, if the patient has a neurodegenerative disorder, this kind of disorder has to be addressed beforehand in order to help them recover or even maintain the damages that has already been done to the body. And if they are financially not able to pay for the fees, Medicare has a reimbursement policy, and the patient or the family has to just apply for the reimbursement form, and the fees will be paid back to you. A lot of them doesn't know, but this is one of the methods for you to help financially. And also pharmacological and non-pharmacological interventions are in place, and of course with pharmacological it comes with an adverse reaction to it. Thank you.
Please find our references for our presentation, and thank you very much for listening.